Well, welcome back, welcome back. One of our favorite guests is in the studio today, Kim Rosson.
Hi, Kim.
From the North Arkansas Regional Medical Center Foundation. How are you doing?
I'm good. You doing all right?
I'm doing just fine.
Great, great.
So,
Excited to be here.
You know, this time of year we start thinking about the holidays and getting with you to do the Christmas parade and everything, and there's been decisions made.
Yes, yes.
You want to tell us about that?
I will. We've had some changes. It all started back in March when COVID hit, and literally the day we were moving the props and things to the Duran Center for the gala, we had to pull the plug on that because of COVID.
Yeah.
So it was pretty rough. We are not able to have. We weren't able to have that. We weren't able to have our 5K. We weren't able to have our golf tournament, and we're not going to be able to have a lot of our holiday events this year, just due to COVID. But one of the things we are going to do is we wanted to do something different this year because of in the holidays. And of course, we always love doing our Christmas parade with you guys, and I hate that we're not going to be able to do it. I think they are going to still have the parade.
Okay.
But we're just not able to do that. We can't bring people in,
Right.
you know, to the hospital. I mean, we're still not able to do that. And I think it's just a little too close quarters for everybody. But one of the things that we wanted to do this year is, because as you know, on Santa's Shuffle Fun Run, we always give gifts to children. And we gave, last year, we gave over 970 gifts to 19 different children's organizations. So, being that there's a problem because of COVID and people can't come in the hospital, the Santa Shuffle's too close quarters and the gifts, and so what we're going to do this year, we're going to try something different, and we have our auction items from our gala auction that we were not able to use, that are very time sensitive, probably over 70 gifts. And we are actually going to have a holiday online auction. And that's going to start November the 5th, and I'll come back the day before and talk about that more. November the 5th, and it'll go till December the 4th. And so it goes for about a whole month. And but the best part is we're bringing back. We're partnering with, you helped us last year on our Santa Shuffle Fun Run videos, and this year we're partnering with we're partnering with Gob TV. And we're very excited about that. The kids are excited, and so we're bringing back the elves. We're bringing the dinosaurs are coming back. Everybody's coming back for the kids, and so 50% of the proceeds that we receive from the online auction is going to go to those organizations, and we're going to give them money this year instead of gifts, so that they can purchase those gifts, and then the other 50% is going to go to purchase TVs for our patient rooms in the hospital. So that way we still get to give back to the community, because the community has been so great to us throughout this whole process. And that was one of the things that my job kind of became, is people started asking how they could help. And so a lot of people wanted to bring food and treats, and so we started giving food to different departments, and we ended up doing that over 8 solid weeks of food we had from people. So everybody's just been really good to us. So this is a way that we can at least give back to the community what they've done for us. So.
Wow.
Well, I guess that did put a damper on things, and it restricted a lot of the activities that you were doing, and I'm sure
and
that
funding.
Funding,
yes. Yeah, it's been very difficult because our foundation is really a event oriented. Event-based, a lot of it. You know, as you know, I do 8 events a year, so not being able to do those has been a strain on our budget. And so we are working really hard to start promoting a planned giving program. And so we've been working on a marketing plan for that to start our planned giving up and major gifts. And, you know, you kind of have to learn to do things different.
I'm sure you've had to brainstorm a bit too.
Oh my gosh, yes. You have to really do a lot of different things. And so that's why this online auction's been we have to be a little creative with that.
What is this then?
Oh, that's our flyer that we're going to be sending out, our card. It talks about Miracle on Main Street. That's the name of our online auction.
Oh, nice.
It's going to be magic. The gala sponsors are actually going to be the sponsors of this, and so we're actually going to do a lot of things with them in magic. And so my son, Dr. Brent Rosson, did the drone last year over for the Santa Shuffle. So we're actually going to figure out a way and make a Santa sleigh go over Main Street and all
That's
that.
sweet.
So it's going to be pretty
That'll
fun.
be
We're going to
cool.
do some
Cool.
promo
That's
videos.
neat.
So
Yeah.
so
Oh,
that's
nice.
what that is, and we're excited about that. But
Cool.
but yeah, you're right. I've had to learn to do things a lot different. And
Yep.
so it's been a struggle.
And
Yeah.
it may strengthen you for when we get back to where things are in normal. You use
Whatever
what
the
you've
normal.
learned.
Exactly.
Yeah.
Well, and when I've met with a lot of different other foundations that are going through the same hospital foundations that are going through the same thing, and a lot of those, their plan giving program and is really what carried a lot of them through this, because hospitals, we really struggle with not being able to do surgeries, and thank goodness we're able to do outpatient surgeries now, but we went several months we couldn't do that, and that's
Yeah.
really hurt. I mean, as you know, your husband's involved in that, and that's a struggle.
Yeah.
And we really suffered for that, and it's just in not knowing about a lot of different things, and so it's been, we're not able to have people still come into the hospital,
Right.
and that's terrible. I mean, it's awful and it's sad, and I know my dad had outpatient surgery about a month ago, and Mom couldn't go in with him, and
Yeah.
it's just it's really bad. But the hospital has been really good. The staff has been so good about, like, they called him when he went in, they called him in the middle. The doctor called my mom after it was over and told about it, and they called him when he was coming out. So I mean, they're really good about communicating with the families and being sensitive to that during this time. So,
Wow.
Good.
but
Well, to help get the ball rolling, the event is called
it's Miracle on Main Street.
Miracle on Main Street, and that happens
Starts
in
when?
November and December.
It's November the 5th and goes through December the 4th.
And you can go to
It'll be narmc.org.
Yeah, .org.
It's
Okay.
going to be set up kind of like an eBay. So you'll get, like I said, it's all new. I don't know.
Yeah.
I mean, we'll see. It's either good or, but I think the main thing is that we just, we want to do something for the kids.
Sure.
And we're, I would like to say just a few things if I can. Right now we're doing kind of a wear the mask campaign. I haven't it on now, but I'm social distancing and I had it on. We think, we feel that that's very important, that does minimize the spread.
Sure.
Is wearing a mask, and we do it for not only our family, our friends, but our coworkers. And right now we have the preoperative screening at the Bear State Bank building. That we're doing that. The viral screening clinic that we have there has been going since March. We see an average of 40 to 70 people a day there, and 20% or 19 to 20% of those people that go through there test positive. So from August it was 14%, September is 18%, and now October it's 19%. So it's actually gone up, and it's it's kind of bad.
And I think part of that is in the bigger states it became a point where it was really a lot of people got infected.
Right.
And then us in the southern
We didn't.
areas,
Right.
we didn't.
Right.
We kind of lived our life the same way, but as it permeated and people started coming into the area, it started growing.
Well, and
So-
going to events and going to,
Yeah.
I mean, we lost our own Dr. Lee,
Right.
in the middle of all that. That was horrible. And, but Dr. Lee was such a amazing person, not only a doctor, but a person. And he was so funny. And so that was a true loss to our hospital. And so we've seen that side of it where we've lost people and we lose patients, daily.
And it makes it real when
It
it's
does.
Someone your family member.
Right.
I mean, we just, had a friend recently just pass away, and it's it becomes more real to you, like you
Right.
said. And so we just really strongly encourage people to try to stick with the CDC guidelines, the social distancing, washing your hands, wearing your mask. I mean, all those things are important. Get your flu shot this year. That's important. You can go to your local pharmacy or your primary care physician.
I heard that the flu is different than the coronavirus, so you don't
Correct.
want to get both at the same time.
Right. No, it would be bad.
Yeah.
Yeah.
So you need to be
Right.
proactive in that.
And I think some of the senior adults are even encouraging you to get a shingle shot you know, too. Make sure you have your pneumonia shot. You know, as you get a certain age, you need to have certain those things, and because you know, my parents are still living, and so I'm very protective for them. We haven't been. What I hate is I haven't been to church but one time since March, and it's awful. You know, if you have to get used to doing things differently. I watch it on TV every week, but it's a struggle. You know, so, but we're excited about what's coming up. We're excited about our partnerships with Cox Health coming up. You know, we're excited about that. You know, that's going to be bringing specialists, and they're supporting us in that. We also do, we partner with, and people may not realize, we partner with UAMS on the AR Saves program, which is a stroke program, where just a touch of a button and we can get, you know, a facility to transfer somebody or have somebody evaluated or get them to where they need to be, just a touch of a button. We have high risk ultrasound, you know, that we do. There's a pregnancy with a high risk to the mother and the fetus, and so we provide that. We do hand trauma and ER telemedicine, which people may not know. Just the click of a button, you can get to a hand surgeon or a burn surgeon at UAMS, suffering those to give us an assessment about what to do. Emergency screenings, we're going to be doing, working on the mental health screenings. We're going to start trying to get into some of that. We do pediatric cardiograms with Children's Hospital. And see, I bet people didn't even realize that. For children with possible heart defects, we do an echocardiogram done here, and the Children's Hospital cardiologist can do it. We just got a 3D mammo machine, so we're very excited about that.
Oh, yeah, that's good.
We've had it for over 2 months, and we've seen over 350 patients so far, 340 of those with the 3D. And as you know, that is detection of breast cancer. I mean, that saves lives.
Right.
And we can catch it a lot earlier with those. So we're very excited. That was purchased by our hospital auxiliary. And so we're very excited. So we've got a lot of things going on. And we try to stay positive, you know, even though it's, you know, in the midst of this pandemic. But we want the community to know that we're here for them and that we do whatever it takes. You know, if we have to partner with other hospitals to provide the best care for them, that's what we do. And we want to give back to the community because the community has been so good to us. So it's a whole mouthful.
Well, Kim, thanks for you had a lot to talk about.
I had a lot to talk about.
Oh my gosh,
I'm sorry.
No, that's fine.
Okay,
no, we got plenty of time.
Yeah,
we're excited.
And we want you to come back. If you want to come back a few days before the event, we'll try to promote the auction again for you. Yeah. And again, that's going to be coming up November.
It's November the 4th. No, November 5th and to December 4th. Yeah.
Okay. So it's going to be a month long.
Yeah.
And get out there and bid competitively.
Yeah.
Don't bid against other family members in the house because it could go way up over the initial cost of what it's worth.
I know. Well,
thanks for pointing that out.
That's good.
That'll be great for us. Yeah. The more we get, the more we give back to children.
Sure.
There you go.
Yeah.
So,
thanks, Kim.
Thank you.
Appreciate
it. Thank you.
Up next, we have Amanda
McLean.
McLean? It looked like okay, I see it now. Amanda McLean, thank you so much. She's going to be here to talk about the holiday marketplace. Stay with us.